Okay, hello everyone. Welcome to today's webinar in our Healthy POS webinar series here at CounterTools. I'm your moderator for today. My name is Jackie Boards. I'm a project director and the help desk manager at CounterTools. During the webinar today, the speakers Lindsay, Kephart, and Melody Kingsley will talk about Massachusetts' experience with passing flavored tobacco product restrictions at the state and local level and evaluation results from this policy implementation. The goal of this webinar is for everyone to be able to reference and learn from this Massachusetts example. We want you to come away with some helpful information and inspiration to help in pursuit of your point of sale goals and policies within the states you work in. For a little bit of webinar housekeeping, this webinar is being recorded and a follow-up email will be sent after the webinar to everyone with the recording, slides, and any other relevant information and materials pertaining to the webinar. If you have any questions throughout the webinar, please feel free to drop your questions into the chat or Q&A boxes as you see on the navigation bar on your screen. We will hold time at the end of the webinar to answer any questions you may have. Okay, it looks like there is some audio issues. Can you hear me speaking right now? Put in yes or no in the chat box if you can hear me. Okay, great. It looks like everyone can. Some people can't. If you can't hear me, I would either come back in. So leave the webinar and come back in and try your computer audio. And if you're on a cell phone, then you can call in using the call-in number. So there's kind of two ways to hear, either using your computer audio or calling in to the number. It looks like most people can hear me, so we'll continue. Okay, great. To start, I want to give a little background on us at CounterTools. Some of you may have or currently work with us, and some of you may not. So we got our start in 2012 out of the University of North Carolina at Chapel Hill and expanded our work from that point to become a nonprofit organization. We are located in Carrboro, North Carolina. Our mission is to empower communities to become healthier places, starting with the retail environment. We do this by providing consulting and training, whether in person or virtual, on point of sale and policy change. We create storytelling materials like infographics and static maps. We give states access to technology tools we have developed, including the Store Audit Center, Store Mapper, and Post, which many of you on the line have used. We support advocacy efforts in local communities. And lastly, we help disseminate science and best practices like through this webinar series. I want to point out that we have a free online resource called countertobacco.org, which is an ongoing project of ours here at CounterTools. It is the first comprehensive resource for local, state, and federal organizations working to counteract tobacco product sales and marketing at the point of sale. This site offers policy solutions, advocacy materials, the latest research, news updates, case studies, youth engagement activities, and even a media gallery exposing tobacco industry tactics at the point of sale. If you have not already, I would definitely recommend everyone to check this site out. Here's a picture of our team. As you can see, we are small, but very mighty. And here's a snapshot of what states and partners we have worked with in the past and presently. As you can see, we work all across the country. Most of our partners are state and local health departments, but we have worked with other agencies and national organizations, such as the Truth Initiative and the Campaign for Tobacco-Free Kids. Our contact information is on the screen if you would like to email us with any questions or inquiries you may have, and you can also follow us on social media. Now I want to introduce our speakers and hand things off to them. For our speakers, we have Lindsay Kephart. She is an epidemiologist and part of the evaluation team for the Massachusetts Tobacco Cessation and Prevention Program, MTCP, at the Massachusetts Department of Public Health. For the past 4 years, she has supported MTCP through surveillance, evaluation, analysis, and dissemination, including mapping and visualization. Her current efforts focus around addressing tobacco-related inequities in the built and social environment. She received her Master's of Public Health from Tufts University School of Medicine with a concentration in biostatistics and epidemiology. Then we have Melody Kingsley. She is also an epidemiologist and part of the evaluation team for the Massachusetts Tobacco Cessation and Prevention Program, MTCP. She has over 3 years of experience conducting surveillance and evaluation-related activities for MTCP, including analyzing youth tobacco data and evaluating point-of-sale tobacco policies. She received her Master of Public Health from the Yale School of Public Health with a concentration in chronic disease epidemiology. So those are our speakers, and I want to hand things off to Lindsay and Melody. Melanie, we are ready for you.
Hi, everyone. My name is Melody Kingsley, and today my colleague Lindsay and I will talk about how we have done evaluation of flavored tobacco restriction policies in Massachusetts. So I'm going to start by talking about some brief background on youth tobacco use and point-of-sale policies.
If you want to share your screen, Melody.
Oh, it's not working? Oh, sorry about that.
No problem.
Oh, there it is.
There we go.
Great. Okay, so start with background, and I'm going to talk about some of the data sources we use for evaluation of flavored tobacco restrictions. Then I'm going to go into some of the results from some evaluation work we've done on flavored tobacco restrictions and their impact on both the retail tobacco environment and youth tobacco use. And then I'm going to hand it off to, there it goes, to Lindsay to talk a little bit about our current focus on equity and our policy and evaluation work. And then she'll end up by talking about the new statewide flavored tobacco policy in Massachusetts called an Act Modernizing Tobacco Control. So as I'm sure most of you are aware, youth tobacco use is now at an all-time high, both nationwide and in Massachusetts. In our most recent Massachusetts data in 2019, more than 1 in 3 high school students used any type of tobacco product in the past 30 days. And this is the highest rated youth tobacco use in Massachusetts in over 2 decades. This increase has been largely driven by youth use of vape products. And in 2019, youth used vape products at over 3 times the rate of conventional tobacco products, that's cigarettes, cigars, or smokeless tobacco. And one way Massachusetts has worked to address youth tobacco use is through changing the point of sale environment. And in Massachusetts, each community has a board of health that has the authority to pass local level public health policies. Since 2003, communities have passed different types of point of sale policies to impact the tobacco retail environment. This map that's on your screen shows some of the point of sale policies that communities have passed in Massachusetts as of March 2019, so it's slightly outdated. But because tobacco retailers in Massachusetts are required to have a permit to sell tobacco, we are able to keep track of retailer information and conduct enforcement activities and data collection that help us to evaluate these point of sale policies. Now, that being said, not all point of sale policies are created equal, and the tobacco industry uses various tactics to get youth hooked on tobacco and nicotine. And some tobacco point of sale policies impact more than one tactic, and these are considered higher impact policies. One of these policies is, of course, the flavored tobacco restriction policy, which are a higher impact policy because they impact 3 different tactics: exposure to tobacco, access to tobacco, and flavors. And in the past few years, a lot of our policy evaluation efforts in Massachusetts have been focused on evaluating these high impact flavored tobacco restrictions. So now I'm going to talk about some of the data sources that we use for evaluation of our flavored tobacco restriction policies. Now, to start off talking about some of the data that we collect on an ongoing basis is our pricing survey. So because of our permitting and our enforcement infrastructure, we're able to collect data on availability and price of select flavored and non-flavored tobacco products in real time from 100% of retailers each year. And pricing survey questions have evolved over time to capture data aligned with our programmatic focus. So as an example, in this current fiscal year that started in July 2019, we were able to add some additional questions to capture more menthol flavored non-cigarette tobacco products. And later on, Lindsay will talk a little bit more about our current focus on menthol tobacco. And then in addition to the pricing survey, as resources and time allow, we're able to do some more intensive data collection. And as part of a CDC competitive grant we received back in 2014, we were able to do some full inventories of flavored tobacco products in some retailers in select communities. And so really what this entailed was that we had our field staff go out into retailers and actually capture the brand and name of all the individual flavored tobacco products in the retailer. These inventory surveys also allowed us to capture metrics that we don't typically capture in our enforcement data or the pricing survey, such as availability of flavored tobacco product advertising, as well as the retailer experience with compliance to the policy. And then also as part of the competitive grant, in addition to this retailer data, we also were able to do some youth tobacco surveys in select high schools. And we were able to collect some additional metrics that we're not able to usually collect using our traditional youth surveillance systems, like the youth risk behavior surveillance system, just because of lack of space. So we're able to include some questions about awareness of tobacco products in the retail environment and access to tobacco, to just name a few of the variables we collected. And then just to give you a quick idea of what some of these surveys look like, as I mentioned, this is the retailer inventory where our field staff went and listed each different flavored tobacco product that was in the retail environment. And this is a screenshot from our school surveys that we did. We gave schools the option of either doing these surveys on paper, online, or both. And as you can see, we were able to use pictures of some tobacco products when asking about, to help ask about products seen in the retail environment. So then just to give some brief background on the origins of the flavored tobacco restriction in Massachusetts. So the Massachusetts flavored tobacco restriction was based off the restriction that was passed in Providence, Rhode Island in 2012, which prohibited the sale of all flavored tobacco products, including e-cigarettes, but excluding menthol in youth accessible retailers. And this policy was successfully defended from litigation. So Massachusetts used the same language when initially passing local level flavored tobacco restriction policies. So back in 2014, there were 9 communities in Massachusetts that had adopted a flavor restriction policy, and many more were looking to pass in the near future. However, at the time, there had been no prior publications available on the impact of the policy. So in 2014, Massachusetts applied for and was awarded a CDC competitive grant. And we proposed to evaluate the impact of flavored tobacco restriction policies on both the retail environment as well as youth tobacco-related behavior, access, initiation, and use of tobacco products. So now to kind of talk generally about some of the methods that we use for policy evaluation. So we obviously can't assign communities to pass policies. So we do natural experiments instead of randomized controlled trials and use a quasi-experimental design to compare communities that have the policy case communities to comparison communities without the policy. And we're able to leverage existing data sources like the pricing survey, or when time and resources allow, we're also able to do some additional data collection before and after policy implementation in the case communities and compare to data collected during the same time frame in the comparison communities. And so the next few slides that I'm going to go over provide a high-level overview of our findings from some of the evaluation work we've conducted for our flavored tobacco restriction policies. So first, I'm going to talk about some of the studies we've done that have looked at the impact of the policies on the retail environment. So the first study I'm going to talk about found that with adequate enforcement, compliance to local flavored tobacco restriction policies can be high, regardless of community demographics. So in this study, we looked at 38 communities that had the policy throughout the state and compared them to 234 communities throughout the state that did not have the policy. And this is a chart showing when policies from all the communities included in the study were passed and implemented. The pass dates are represented by the circles, implementation dates are represented by the squares, and we group communities based on date of policy implementation. So when I refer to wave 1, these are communities that had a policy implemented between October 2015 and March 2016. Wave 2 had a policy implemented between April and June 2016. And so our results, our outcome was flavored tobacco product availability over time, and we used difference in difference linear regression models that controlled for retailer and community level characteristics to compare the change in flavored product availability in communities with the restriction compared to those without. And within 1 year post-policy implementation, we saw drastic declines in flavored product availability in both wave 1 communities and wave 2 communities, but did not see similar declines in communities without a policy in the comparison communities. And so, like I said, within 1 year post-policy implementation, both wave 1 and wave 2 had flavored product availability under 15%, but comparison communities still had significantly higher availability at 68% of retailers selling flavored tobacco products. And we also looked at the change in flavored tobacco availability by product type. So here in this graph, the top panel looks at cigars, the bottom panel looks at vape products, e-cigarettes, and e-liquids. And in both cases, availability of flavored tobacco products decreased drastically. So compliance with the policy was high regardless of product type. And just some conclusions, we found that within a short, just 12-month period of time, we saw drastic reductions in all types of flavored tobacco captured, cigars, e-cigarettes, and e-liquid droppers. We saw that these reductions occurred regardless of time of policy implementation. And we also found that these reductions occurred regardless of community and retailer level characteristics. And we're confident in these findings because we had a substantial control group of 234 communities, and these reductions were significantly greater than the change in flavored tobacco availability in communities without the policy. But it is important to note that compliance with the policies was aided by the enforcement infrastructure and resources that were provided to enforcement agents across the state in Massachusetts. This includes multiple enforcement trainings, as well as educational visits and materials for retailers that included a list of all known flavored products at the time. So the next study I'm going to talk about found that flavored tobacco restriction can drastically reduce flavored tobacco product advertising, as well as flavored tobacco inventory in the retail environment. And this study was done in Boston and used data from the intensive flavored tobacco inventories that I talked about earlier, conducted by our field staff, where they went in and counted all the different types of flavored tobacco products before and after the policy was implemented in a sample of retailers in Boston. And this analysis found that within just 6 months, not only did availability of flavored products decline, but also the average number of flavored tobacco products sold by retailers declined, as well as there was a decline in the percent of retailers with flavored tobacco product ads. It declined from 54.5% to 25.8%. And then, so after 6 months, there were only 51 out of the total 353 retailers that were surveyed that were not compliant with the policy. And of the non-compliant retailers, almost half were only selling one flavored tobacco product. And in total, out of all of the non-compliant retailers, there were only 144 flavored tobacco products left at follow-up. And the majority of these products were cigars, cigarillos, or blunt wraps. And then the top flavor left was blue, which is a concept flavor or a product that is flavored but does not explicitly state the name of the flavor on the packaging, as well as grape, vanilla, and chocolate. The conclusions from the study were that prior to the restriction, many different flavors were available in youth-accessible stores, but the restriction in Boston led to a decrease in flavored tobacco availability and flavored tobacco advertisements in youth-accessible stores, and retailer compliance was aided by enforcement visits and educational materials that were provided to retailers, such as the flavored tobacco list. That being said, some limitations were that, or some remaining challenges were that concept flavors may pose a challenge to compliance, and then at the time, this policy did not include menthol flavors. Those were still available in youth-accessible retailers. And then moving on to studies looking at the impact of flavored tobacco restrictions on youth tobacco use. This next study that I want to talk about found that that flavored tobacco restrictions can reduce youth use of flavored and non-flavored tobacco in the short term, so within just 6 months. So in this study, we matched a Massachusetts community with a policy, Lowell, Massachusetts, to a similar community without the policy, Malden, Massachusetts. And in these communities, we conducted, again, those retailer inventories and a census of all retailers in the two communities at baseline and follow-up. And we also administered surveys to a sample of randomly selected classrooms in high schools in the communities at baseline and follow-up. So in Lowell, the case community, at baseline and follow-up, we were able to conduct over 100 retailer inventories and over 500 youth surveys. In Malden, we were able to conduct about 50 retailer inventories and over 600 youth surveys at both baseline and follow-up. And then looking at the results, we found that from baseline to 6 months follow-up, availability of flavored tobacco in Lowell decreased by 70 percentage points. However, in Malden, there was almost no change in availability of flavored tobacco from baseline to follow-up. Looking at the impact of the policy on youth tobacco use, we found that from baseline to follow-up, ever and current use of both flavored and non-flavored tobacco decreased in Lowell, while it actually increased in Malden. We also used difference in difference models that adjusted for age, gender, and race ethnicity to compare these changes in youth tobacco use in Lowell and Malden, and found that the changes in both flavored and non-flavored tobacco use were significantly different between communities, even after adjusting for youth demographics. So then some conclusions from the study were that we found that the flavored tobacco restriction policy decreased availability of flavored tobacco products within just 6 months. It also decreased use of both flavored and non-flavored tobacco products among youth within just 6 months, which also suggests that the policy did not necessarily drive youth to switch to non-flavored tobacco products. One thing we didn't find, though, was that we didn't find that the policy impacted initiation of tobacco use with a flavored product in the short term. So future studies could assess the longer-term impact of the policy on this outcome. Which brings me to the final study, which is looking at whether flavored tobacco restriction policies can sustain this reduction in youth use of flavored tobacco in the long term, and whether it will impact other types of tobacco-related outcomes. And so stay tuned for these results. We're actually currently still working on the final draft of this manuscript. And now I'm going to turn it over to Lindsay.
Great, thank you, Melody.
Okay, hi everyone. This is Lindsay, one of the epidemiologists for MTCP. I'll now be talking a little bit about our program's focus on equity and how we consider equity in our evaluations. So this graph shows in Massachusetts overall, the smoking rate has been steadily decreasing since 1996, reaching an all-time low in 2016. Overall, smoking rate is that kind of thick blue line. However, despite this reduction in the smoking rate for the state overall, certain populations continue to be disproportionately impacted by tobacco use and face significant barriers to quitting. So this trend data over time shows that those with poor mental health, that's the top red line, and those with a low socioeconomic status, the green line right below it, have consistently higher smoking rates than the average. And again, this is a trend that has persisted over time. In Massachusetts, there are several population groups that tend to be disproportionately affected by tobacco, including those with disabilities, those with Medicaid insurance, people of color, those who are LGBT. And we also want to recognize that these are populations not only disproportionately affected in Massachusetts, but tend to be disproportionately affected kind of everywhere nationally. In Massachusetts, the smoking rate also tends to be correlated with median income of communities, where communities with a lower median income tend to have a higher smoking rate, and those with a higher median income tend to have a lower smoking rate. We also tend to see higher retail density in lower income areas of the state, and that's kind of something that's been true throughout history, again, here in Massachusetts and in other areas of the country. So we also observe these geographic disparities in tobacco use in Massachusetts. So we also work on incorporating a racial justice lens into our surveillance and evaluation work. When we disaggregate our data by race and ethnicity, we've really been able to illustrate the presence of inequities in tobacco use, cessation, and exposure. And these inequities kind of disproportionately affect people of color, but they also disproportionately affect a lot of the other subpopulation groups I mentioned before. So for example, although Black and Hispanic populations in Massachusetts smoke at the same rate as white populations and attempt to quit smoking at similar or higher rates, people of color have lower rates of permanent quitting compared to white smokers. And again, this is a trend that we see over time. I also want to note that this trend graph shows kind of the confidence interval. So for white smokers, the confidence intervals tend to be pretty tight. And then the trend line for people of color, the confidence intervals tend to be pretty wide. This illustrates just the data collection limitations of trying to get good data from other population subgroups. But even with those data limitations, we still kind of see this consistent trend over time. And when we're also doing kind of this racial equity work, it's also really important to discuss the contextual reasons why we see racial inequities in cessation in this case. So in Massachusetts, people of color report greater barriers to care and cessation resources. Research shows that there's greater retail density and more tobacco availability and advertisements in communities of color and low-income communities. Cessation may be a lower priority when faced with things like job instability or underemployment. And people of color face unique stressors due to racism and discrimination that, again, might make it harder to quit, or kind of the stress and stigma from these things might sustain tobacco use behaviors over time. So this figure shows kind of this framework that we use to talk about tobacco-related inequities. It helps us focus on talking about upstream factors and structural systems that end up determining kind of the downstream behaviors and health outcomes, that all the things that affect individual behaviors. All of this help us identify all the conditions that might affect tobacco use, cessation, and exposure, and why some populations are disproportionately affected by tobacco. So for example, where you live might determine how exposed you are to tobacco. If you live in an area with more retail density, you will be exposed to more tobacco availability and advertisement. Greater exposure to retail density can influence youth smoking and make it harder to quit and easier to kind of relapse use. So that's kind of the built environment section here. However, when talking about the built environment, we also want to talk about the contextual history that has determined what our neighborhoods look like. So things like structural racism, for example, have influenced policies like racial redlining and racial residential segregation, historical policies that determine where people of color and white people could live. Although these things happened a generation ago, the effects are still largely felt today. So by identifying all the upstream factors that influence or determine inequities, we can create more, or we can support more thoughtful programmatic and policy solutions that address root causes. And thinking upstream allows us to be kind of more thoughtful in our evaluations as well. So as the flavor movement grew in tobacco control, more attention was also paid to menthol, mint, and menthol cigarettes. So I want to acknowledge that people and organizations kind of have been working on menthol for a long time now. Menthol cigarettes are an important equity issue and a racial justice issue. Research nationally and locally in Massachusetts shows a greater proportion of menthol advertisement in communities of color than in white communities, with one study showing that advertised prices of menthol cigarettes were on average 36 cents cheaper. Tobacco industry documents show a long history of deliberate targeting of menthol cigarettes to women, Black populations, LGBT populations, and low-income communities. Tobacco industry documents show that the tobacco industry targeted Black Americans through targeted magazine advertisements using positive images, event sponsorship, funding to Black organizations, and even kind of the going into these communities and distributing free samples of menthol cigarettes. So this targeting has led to high menthol use rates among Black youth and Black adults, where Black youth and adults use menthol cigarettes at much, much higher rates than any other racial or ethnic group. And this is really concerning because menthol cigarettes have been found to be more addictive and harder to quit. So given our interest in menthol and our data availability, we used pricing survey data that Melody discussed earlier to examine the pricing practices of menthol cigarettes in different demographic areas of Boston. Basically, we want to look at the association between race and menthol cigarette pricing in different block groups in neighborhoods of Boston. And we also want to look at the association between retailers selling cigarettes below minimum price and racial demographics in block groups in Boston. So the pricing survey has a lot of different data about tobacco products in our state. So it has availability data, do the stores carry the brands, pricing data, what's the price per pack, the percent of retailers selling below minimum price, whether the store is chain independent, and actual kind of address location data for each store. So we compared the price of menthol cigarettes, which in this case are Newport Greens, to 3 other menthol brands, Marlboro Red, Pall Mall, and Camel. We used location data to link the pricing survey data to American Community Survey data on the block group level, and linked kind of that data to the demographic data in GIS, so it can model the relationship and control for additional demographic covariates like the proportion of youth, education, median income, gender. So we found that an increase in the proportion of Black residents was significantly associated with a lower average price of Newport cigarettes. For every 10 percentage point increase in the percent of Black residents, the average price of Newport cigarettes decreased by 3 cents in Boston. We did not see this relationship between percent Black and the price of any other non-menthol cigarette brands. This relationship between race and price was only present for Newport, which is a menthol brand. We also saw a greater proportion of retailers selling Newport cigarettes 25 cents or more below minimum price as the proportion of Black residents or Latino residents increased. And again, we didn't see this relationship between race and non-menthol cigarette pricing. So these results lead to a few implications of note here. We found the significant relationship, which is one of the more expensive menthol brands here in Massachusetts. So the effect size might be even larger for a cheaper brand. Increasing price is a tobacco control strategy. Higher prices might reduce not only a single-use propensity to smoke, but also their peers as well. However, lower prices might make these products more accessible to youth. Lower menthol prices might just be considered the norm alongside more Newport or menthol advertisements, peer and family use of menthol cigarettes, and all of these factors together might impact someone's decision to initiate and continue to use menthol products. And lastly, this kind of adds to the evidence of tobacco industry targeting of menthol products, not only through more advertising, which I mentioned before, but also lower pricing strategies. All these factors together, alongside the historical targeting, creates this environment where Black residents are disproportionately exposed, used, and are affected by poor outcomes from menthol cigarettes. So in November 2019, the Massachusetts governor signed into law an act modernizing tobacco control, which has a fair bit of components, which I will briefly go over. So in the wake of the vaping epidemic, the new law provided the Department of Public Health authority to regulate all flavored tobacco products and e-cigarette products. This law has two major components that went into effect immediately, and another kind of set of components that will go into effect later this year. So effective immediately, retail stores can only sell non-flavored nicotine products with a nicotine content of 35 milligrams or less. However, adult-only retailers like smoking bars or vape shops can sell non-flavored nicotine products with a nicotine content of 35 milligrams or more. And the sale and consumption of flavored nicotine vaping products can only occur on premise of a licensed smoking bar. And then beginning in June 2020, the sale of all flavored tobacco products, including mint and menthol, thus including menthol cigarettes, cigars, and chewing tobacco, can only be sold at smoking bars for on-site consumption. Retailers cannot advertise for products that they don't actually carry. So in this case, flavored products would be a really good example of that. A 75% excise tax on the wholesale price of nicotine vaping products, and in addition to the state's, it's actually 6.25% sales tax will be imposed on vaping products, and insurers in Massachusetts have to provide coverage for tobacco cessation counseling, and all generic FDA-approved tobacco cessation products with at least one product available for no out-of-pocket cost. So as I've outlined, there's a lot of really interesting components. We'll continue to use some of the surveillance and evaluation tools we outlined earlier to measure the impact of the law on the retail environment and adult and youth use. So given the large amount of things covered by the law, there's likely to be some unintended consequences. For example, some nicotine-addicted youth may switch to combustible tobacco. Youth who live in border communities to other states might still have access to flavored products. Menthol smokers might switch to other products instead of quitting, especially given that menthol cigarettes are more addictive and harder to smoke. More addictive and harder to quit. Additionally, communities of color may disproportionately be affected by things like racial profiling for the sale and possession of menthol cigarettes. Some adults who use vape products for cessation or harm reduction might have a harder time accessing their products. And additionally, the tobacco industry is constantly introducing new tactics to get around regulations, like the introduction of menthol-flavored capsules to use while smoking non-flavored cigarettes. However, this law will likely have major benefits on public health. The law will likely, kind of given what we know from our past flavor product restriction evaluations, we think that the law will likely reduce youth access to flavored vape and tobacco products in stores. Youth who primarily use flavored products might consider quitting, and a lack of flavors in general just might reduce the appeal of tobacco products among youth. This law also further reduces access to high nicotine products in youth-accessible stores, and the taxes might impact purchases of these products by price-sensitive youth. Massachusetts is the first state to restrict menthol cigarettes, effectively closing the loophole left behind by the 2009 Family Smoking Prevention and Tobacco Control Act, which banned flavored cigarettes, except mint and menthol. So this law will largely remove menthol cigarettes from the retail environment and may motivate some individuals to quit smoking, or again, kind of just make initiation of these products very hard and unappealing. So overall, this law is a comprehensive piece of legislation that will likely change the retail environment and influence tobacco use behaviors in the state. So these are some of the things that our program will continue to monitor in the short term and the long term as the new law is rolled out. And given kind of all the things we talked about in this presentation, you can kind of, and the things I talked about on the slide, you can kind of get an idea of all the different, of all the data sources and different things we'll mobilize in order to measure the actual impact of this law going forward. So that's all we have for you today, and I think we can take questions now.
Yes, thank you, Lindsay. So yes, if anyone has any questions, please drop those into the chat or Q&A boxes and we'll take questions. We have a good bit of time for questions, so if you have anything on your mind, just please drop that into the chat or Q&A boxes and we'll go from there.
And also, if you all have questions later or want to look at the actual papers, feel free to email either of us. We'll be happy to answer any additional questions later and disseminate copies of those papers we talked about today.
Great. We will pause here for any questions. And Lindsay, if you want to stop your share, I can bring up the PowerPoint on my screen and see if there's anything
Sure.
that comes up. Great. Okay, let me. Okay. So we have some questions, and let me go to the end of the slideshow. I'll bring your contact information back up on the screen. Okay. Okay, there we go, back again. Okay, so we have some questions that have come in. Yeah, but thanks for this presentation. Did your evaluation of access to flavored e-cigs try to look at availability via internet sales?
So our evaluation did not look at anything on the internet. Our data sources, unfortunately, did not allow for us to look at anything related to the internet. You know, at the time, you know, our flavored restriction policies didn't actually impact, like, had no connection to the internet in terms of, you know, flavored tobacco products. It just applied to the actual, like, you know, brick and mortar stores. Mm-hmm. Of course, that being said, it could have definitely still impacted internet sales, but unfortunately, we weren't able to look at that.
One question that we have on one of our youth surveys from Massachusetts, I think it's the Massachusetts Youth Health Survey, we asked youth where they get their products from. So one thing we'll probably continue to monitor is the proportion of youth that get their products from the retail environment versus the proportion of youth that get their products from online or the internet.
Great. So, we have another question. What is the amount of children that were impacted by your flavor restriction So I don't know if local level or state level, but.
So I think by the March 2019, the map that Melody showed earlier, it was nearly half of the states, I think more, were covered by a flavored restriction. And so that was, I think it was either 60 to 70% like of the population in those of Massachusetts were covered in those communities. Mm-hmm. Now it should be, because menthol and all flavored products are restricted to smoking bars, it should be, I think the youth population in Massachusetts is about a fifth of the total population in Massachusetts. So hopefully all of those will be covered by the new law.
Mm-hmm. Mm-hmm. Great. I have another question. Do you have suggestions for other states that have limited evaluation resources but are looking to prepare a case for the need for a similar type of flavor restriction? Any recommendations or suggestions for states that may have limited evaluation resources, or what they can kind of do to kind of prepare a case?
So in Massachusetts, we didn't really have too many. We actually had no surveillance tools that looked at menthol use. So what we did was we did focus groups. We also used national data and research from different areas. So there's been a lot of great studies in California, DC, St. Louis that help kind of support and make the case for including menthol in our flavor restrictions. So a lot of people around the nation have done amazing work, and we can kind of use that work to propel our own work as well and provide kind of more rationale to why we should be doing it here as well.
Mm-hmm. Definitely. Let's see, can you provide the specific increase, decrease in youth use comparing case community to comparison community and the degree of confidence? I know it was only 6 months, but interested in numbers. So can you provide the specific increase, decrease in youth use comparing case community to comparison community and the degree of confidence?
Yeah, so I don't have the paper in front of me, and I'm trying to pull it up, having some technical difficulties, but yeah, so we can definitely send out all the papers afterwards. What I do remember is that, in Lowell, there were increased, like everything was mostly an increase in both ever and current use of flavored and non-flavored tobacco. Sorry, those are decreases. And in Malden, the community developed a policy. There were increases. I think some of them might have been significant from baseline to follow-up, but not necessarily. But what was significantly different, as I mentioned in the presentation, was the difference in difference. So it was significantly different between communities, but it wasn't necessarily significantly different from baseline to follow-up. But all those numbers are in the paper, so we can send that out.
Great. For the new law, how will retailers be made aware of which products are flavored? Will there be a list of products they can or can't sell? What about products with ambiguous concept descriptors? So, for the new statewide law, how will retailers be made aware of which products are flavored? Will there be a list of products they can or can't sell? And what about products that, have ambiguous or concept flavors or descriptors?
So in the past, we had our field staff kind of do the primary data collection in stores and figure out the extent of flavored tobacco products being sold, and created this huge long list. As you can imagine, there are thousands and thousands of flavored tobacco products. At this point, it's kind of easier to figure out what's not a flavor than having a list of what is a flavor. Additionally, we also have a lot of enforcement and educational field staff who have been doing flavored tobacco restriction work for years now. So they kind of have the expertise to help retailers comply with policies. And Melody talked a lot about our infrastructure and how that infrastructure really did lead to good compliance. And we really don't want to kind of punish people immediately for not following the law exactly on their first try. So we really do spend a lot of time doing a lot of retailer education. I believe there will be additional funding for other communities in the state who haven't been typically involved with tobacco control to have that educational and enforcement infrastructure to enforce the new law going forward. So we really do have this really great infrastructure across the state that will aid with retailer education and compliance. And concept flavors will always be a challenge, but that's something that we've been kind of working on for years now, and that's kind of done on a case-by-case basis.
Got it. Another question, is the provision prohibiting the advertisement of products that retailers don't actually carry from the November law or an earlier law? So the provision prohibiting the advertisement of products that retailers don't actually carry, is it from the November law or an earlier law?
I do believe we didn't really have anything about advertisements prior to this November law, so I do think that is a feature of this new law.
Mm-hmm. Another question, does the new bill include a flavors exemption for cigar lounges?
That's a good question. I'm not exactly sure how cigar lounges are classified in the state. If they are classified as a smoking bar, they will be they will be able to have people purchase and consume flavors on premises. Otherwise, they would be kind of considered an adult-only retailer, wherein no flavors would be allowed to be sold, but they would be allowed to sell the higher nicotine content products.
Got it. Okay, got a couple more questions. Just a general question. So could you provide where you get your information from St. Louis? We're looking for states other than California to provide more proof that this is an effective tool in various states, not just progressive states. So could you provide where you got the information from for St. Louis, and, just kind of giving some information on, giving proof that, this is something effective to do in various states, not just progressive ones?
Yes. So I believe that was a study by Combs et al. It was 2019? Or no, it was earlier. It was 2015, I think. But I will try and find that study and disseminate it out. I don't have the citation on me ready, but in my Boston Menthol paper, all of the kind of literature I talked about menthol is definitely cited and included in that paper, because it was so influential for designing the research question and kind of adding to this evidence base that's been generated over the past few years.
Got it. Okay. Then we have another question. Among adults, harm reduction by switching from combustibles to aerosols is championed by some tobacco policy efforts. What is the current climate on this issue in Massachusetts? So harm reduction by switching from combustibles to aerosols is championed by some policy experts. So what is the current climate on this issue in Massachusetts?
So right now we kind of follow what the CDC says. So in the latest Surgeon General report, there was some evidence that e-cigarettes can kind of can be used as a harm reduction tool, might aid with cessation in some cases, with other cases, not so much. So it really is we're still really lacking the kind of evidence that really definitively poses e-cigarettes as a approved harm reduction advice. So right now in Massachusetts, kind of everywhere across the country, I imagine, there are different point of views about its utility as a harm reduction advice. So it's the same in Massachusetts, where some people are very in favor of it, some are not or pretty against it. Right now, as I said, we just kind of are following the CDC's guidance.
Got it.
I also do want to note that the new flavored tobacco restriction isn't a ban on vape products. even though flavored tobacco products, including flavored vape products, will be restricted to just smoking bars, but any tobacco flavored vape product will still be available in any of the convenience stores, as well as in the adult-only tobacco retailers. So vape products will still be available in Massachusetts, just the flavored ones much less so.
Great. Have a few more minutes. If anyone has any more questions, you can drop those into the chat or Q&A boxes. Give it another minute or two for that, and we'll close things out. We have a question that came in. Is there any effort to limit the number of smoking bars allowed?
So that's definitely a concern. In Massachusetts, one of the policies that towns can adopt is called capping, which limits the amount of tobacco retailers that can be in a certain geography. In this case, it's usually the municipal level. So in theory, towns can definitely, if that's a concern, and there will definitely be retailers that switch to smoking bars status in order to sell flavored products. Towns can pass these capping policies on a municipal level and kind of aim them at adult-only retailers or smoking bars in order to limit or prevent kind of an uptick in the presence of smoking bars in certain communities.
Great. Good to know. Looks like there are no more questions at this time, so we'll go ahead and end things. So thank you to everyone for being on this webinar today. This webinar has been recorded. So basically what I'm going to do after this webinar, in the next day or two, I will send everyone who attended this webinar a follow-up email. And in that follow-up email, I will provide the slides, the recording, I'll provide the contact information of Melody and Lindsay, and also the studies and papers that they discussed today and any other supplemental information that may be helpful to you. So you'll get all of that goodness in a follow-up email that I'll be sending in the next day or two. Hopefully this webinar was helpful to everyone. I hope you took away some helpful information from Massachusetts kind of experience with doing these policies and restricting flavored products. And we will stay on the line for another minute or two if anyone has any last minute questions or comments that they want to provide. But thank you again for being on this webinar, and look out for that evaluation email from that follow-up email from me after this webinar. Thank you, Melody and Lindsay.
Thank you.
Thank you.